Joining us tonight, or this afternoon, Jeff Rowe, the newly named president of Premera. Thanks for being here. Lance Hunsiger, the CEO of Community Health Plan. Thank you for being here. Preston Simmons, CEO of Providence Regional Medical Center, Everett. Thank you. And Representative or Group Health Nurse Eileen Cody, who also serves as the chair of the House Health and Wellness Committee. Thank you for joining us. This is kind of a stellar cast, I gotta say. I appreciate all of you being up here. Gentlemen, I sort of feel like, though, that there's only really one person with power, and that's Representative Cody, for all of your resumes.
That's a joke.
Well, no, I don't know about that. We'll start with you, Representative. You are the Dean of the House. You are the chair of the committee, and many people think the only person in the Pacific time zone that Speaker Frank Chop fears and sometimes listens to. What did you think of the governor's comments today and some of the content that you've been hearing overall? You've been here, quite a while. What do you think?
Well, I don't know that Frank Chop ever fears me, but I would like that idea. No, I think that the governor outlined actually what we will be working on, and I think that the request legislation that he's moving forward, but we've already actually, the good news is I think that the idea of the breastfeeding bill and expanding on the work on that is one of those feel-good things that we all agree upon, and will actually make some difference in outcomes for children. So that's a positive thing, and actually, I don't know if Senator Becker is in here. We're going to, we have a grant, the State Department of Health got a grant that working on that, and that bill is actually coming out of the work on that grant, and so we're going to be going down to San Diego for a meeting with all of the grantees this weekend. So that's been a positive thing. And then I think that the other grant, that the CMMI grant, is where the transparency discussion comes out of, and that was the other major piece of legislation that the governor referred to that's going to be requested. And so those two things I think we will be moving forward on, and pretty excited about that.
Yeah, good.
Because I think that really the focus now, we've kind of done healthcare reform, not that it's totally worked out, but we at least don't have to fight about that now. And the focus is really trying to bring down the cost of healthcare. And I think that's what we'll be focusing on.
Mm-hmm. Jeff, I will note this first. Well, congratulations on the new position.
Thank you.
As we were discussing, on the list of press releases at the Premera website, the press release that announced you would be the new president, taking over time for Gubby Barlow as he moves towards retirement, was listed right after a partnership with Silver Sneakers, something or other. And that, for me, talked about, sort of signaled the understatedness of your leadership. Tell us about your vision for Premera, what you're hearing and thinking about today, and where your mind is as you're trying to, as you move into the new leadership role at Premera.
Yeah, well, thank you, first of all, for the congratulations, and I think it's appropriate that I followed Silver Sneakers, though I'm not quite at the point of needing those services. And thanks for having me here today and for allowing Premera to be a sponsor. It's a great event. We're at a historic time in healthcare. I can't think in my time of 15 plus years with Premera of a period when there's been more change and more dynamic activity in the industry than there is today. And in fact, I think you can go back all the way to the 60s to the creation of Medicare and Medicaid to look for a time when there was as many new things happening in healthcare as there is today. So it's a very exciting time to be in healthcare. And I think you're seeing all sorts of new things emerging as a consequence, in particular consumers becoming more aware about their own health care and about the costs of health care and the options for obtaining health care. And you've got employers doing different things, considering different things, including private exchanges. You've got, as we've heard throughout the day, all sorts of activities happening in the provider space. So it's really a dynamic time, and so it's an honor, of course, to lead Premera. It's also exciting to be a part of all that change. The biggest change that we've seen, of course, in the last 3 years is around the ACA. And from my point of view, the jury is still out on the ACA. I think it's done some very good things with respect to access, has been noted many times. Less has been discussed around cost, but as evidenced by the engagement today and by the ideas that were shared at some of the breakout sessions, there's a lot of private sector initiatives as well as those in collaboration with the public sector that could lead to some really positive developments in that regard. So your question was really about the future and where Premera is going in that regard. And I would say it's more interesting to talk about where the industry is going, and I think sustainability is something that continues to be on the top of our minds. And Premera's bedrock of our mission is to be two things really: to provide peace of mind to our members and to be a leader in creating a sustainable healthcare system. So we're looking at ways that we can continue to do that. I think the problems and the complexity of those problems require some new thinking and some more creative ideas than we've used in the past, and we hope to bring some of those to the table. For instance, around transparency, another thing that was discussed at a session today. And something that we're working actually with Providence on up in Snohomish County is moving kind of the conversation further upstream. So much of the conversation's about care, and more of it could be about health and population health in particular. And I heard Sue Grinnell talk about the 4 factors that drive chronic conditions, limited activity, diet, tobacco, and alcohol. And I think there are things we need to do to continue to attack those things in order to make the healthcare system as a whole more effective.
Great, yeah. It would strike me, Preston, that sometimes it can be tricky to get upstream when you're a hospital. That's not, it's not a primary care office, and it's not not always a mental health outpatient facility. Sometimes can be. Tell us about what you're doing to sort of get upstream and how you are engaging in this broader triple aim community health conversation.
Sure. First of all, thank you also for inviting Providence Health and Services here today, and along with colleagues. Excited to talk a little bit about what we're doing up in both as Providence Health and Services. Our core strategy is creating healthier communities together, and that really fits within the triple aim concept of the patient experience of care. And we always define that looking at quality service and access and the affordability piece. And if we do a good job on that, then we can improve the population and health. In Snohomish County, there was a group of leaders that got together about a year and a half ago representing a broad range of organizations. There's Providence, there's Premera, the Everett Clinic, the Verdant Health Commission, the Economic Alliance, the school districts, the health department, and several others. And we decided to say, what are a couple things that we could do constructively as leaders coming together as organizations to drive down the cost of care and improve health within the community. So we looked at 2 projects that are really bookends of life. One is a youth activity initiative, and the idea there is to increase activity levels in 5th graders within the county, because if you have activity levels, it's precursor to obesity, which can get into diabetes, chronic heart disease, and others downstream. And typically these are, they're still an age of kids that, at 5th grade, they still listen to you. And so you can affect their long-term health promotion and wellness kind of mindset. The other initiative is looking at the other end of life, looking at palliative care, which is really a patient and family-centered initiative in terms of if you have a chronic disease or end-of-life decisions, and make sure that families and the patient are well informed of how to make the best decisions in terms of their course of care. So our goal on that one is to educate every primary care physician in Snohomish County and a subset of consumers. Going back to the Kids Initiative, as the end of this month, 95% of all 5th grade students in Snohomish County will be having a 3D accelerometer. It's involved in all 240 classrooms in the county.
What's a 3D accelerometer?
It's a wristband that measures both intensity of motion and motion. And it's tied in with a social media platform where there's a reward system and they can communicate with each other. The sync stations that they take these bands are in the classrooms. And the teachers are super excited about this because it integrates into their health promotion and wellness criteria. And then from a kind of a scientific basis, we can step back as a county and understand why Mukilteo, for example, has higher activity levels than, say, Sultan, and then go back and learn from each other. And we're going to do this every year and track it, and so that we can improve those kids' health and hopefully lower the costs of care.
You know, pardon me this editorial comment, but if you were the CEO of Providence Medical Center Anchorage, and you said you were going to put wristbands on all the kids so that the government at the school district could track them, they go over a little differently probably than here in San Francisco. You know?
I don't know. This is actually, what they're finding is the satisfaction among both teachers and the kids is just kind of off the charts. So it's a fun initiative, and it's a way to get activity levels. And if anybody watched any of the football games last week, you know that even the NFL is getting into promoting the 60 minutes of wellness a day. And there was an article in the news this morning about only one, it's really sad, only 1 in 4 teenagers are meeting that activity level in Washington State. So this is going right after that.
Yeah. So Lance, first, I believe it's the 20-year anniversary of Community Health Plan of Washington. Is that
We
accurate?
have celebrated 20 years, yes.
Yeah, so congratulations to your
Thank
organization,
you very
to
much.
your board, and to your staff. You know, as one of the state's largest Medicaid plans and you know, certainly the largest that's based here in Washington State, what is all this talk that we hear from the governor and the agency leadership about a future procurement and change to how we structure Medicaid? How does that excite you, concern you? I mean, on the one hand, CHPW does a lot of integration already and has close relationship with the state. On the other hand, it's a lot of change. And
Yes.
the last procurement has had some bumps in the road. What concerns you and what excites you about this future procurement conversation?
Well, since we're talking about an unknown, it's hard to say. But we don't see ourselves strictly as a health plan. As you know, and I think many of you all know, we're associated with the Community Health Network of Washington, who counts its members, 21 of the community health centers across the state. So we're not purely a health plan. We think of ourselves more as integrated, including the delivery of health care. Obviously, when you look around this country, and I've studied you know, healthcare in other countries on 3 different continents, nobody's figured out the right way to do this. So the fact that the state's continuing to look at new ways of doing things and reevaluating is not a surprise. And you know, whether it continues to be through traditional health plans, as we're doing right now, or whether it's some other model, we anticipate that we'll be participating in all that one way or another. So are there concerns and worries and whatever? Yes, obviously, because it's the fear of the unknown and the future, but to expect things not to change is unrealistic too. So we'll see how it goes, and we plan to be there and participate and hope to be a big part of it.
You've been involved in healthcare systems in different parts of the country.
I have.
And you have sort of guided CHPW, and you know, like Dorothy did not call the Healthcare Authority a turnaround, you might not call CHPW a turnaround, but I think you've guided it upwards from a different place than when you took over in 2009. What does the future of CHPW look like in terms of the type of organization it will be, and where is CHPW going in the years ahead?
Well, as I think you already mentioned, we are Washington-based and serve solely in Washington. And so our focus is here. Our focus is primarily on the underserved. Virtually all of our enrollment is either Medicaid and or Medicare. And those are the populations that we anticipate will continue to serve for many years to come, hopefully for another 20 or more. Again, I think in our case, it's more focused around making sure that the underserved get the access that they deserve and certainly should be entitled to, making sure that all populations have access to health care. Everybody in this room, I think, enjoys, you know, high quality of care. I think everybody has that, certainly should have that right. They've earned it, and how do we make sure that we provide that access at the most efficient manner in terms of costs, et cetera. I think that's where the health plan comes in and partners with the community health centers to try to preserve that, and hopefully partnering with the state and finding ways to do that. And whether that's, you know, the way we've done it for the last 20 years or in a different way, I don't think we're really limited to that. So.
Yeah, good. Jeff, Premera is not a turnaround, but some might have called the company that Gubby took over some years ago perhaps a turnaround. What kind of company do you see Premera being under your leadership now that it is, I would categorize really as top of class in the commercial marketplace and full of a lot of really smart people who've been very thoughtful about, you know, the future of healthcare. What does Premera look like under your leadership?
Well, going forward, I'm fortunate, and all of us at Premera are fortunate to build on something that's really strong. I think Gubby has done a tremendous job in his near 15 years leading the organization, and I appreciate your comments. I think we are at the top of the class in our markets, and our job at Premera collectively is to just continue that. And we've been a company that is always centered on the customer. We've put them at the middle of what we do. A lot of companies say that. I think Premera's done it quite effectively, as evidenced by our results. And, you know, we're true to our word. When we walk the talk, and when we commit to our customers to do something, we've done it. I think given the complexities and the scope of the issues that the industry faces going forward, we need to evolve our thinking to be a little more innovative in the way we go about things. And examples of that could be in the ways that we collaborate with providers, for instance. There has to be a way for us to share a number of things financially and information-wise in order to make the system as a whole more effective, and most importantly, to make the experience and the outcome for our members and patients better. So going forward, I don't see wholesale changes for Premera. We've got a strong core. It's our job to build on that, maybe in the process broaden our business a bit, but really continue to do the things that have made us strong and perhaps add some creativity to that in the process. And, you know, if you'd like, permit me for just a second to give an example of that. I mean, we have introduced 14 or 15 now global outcomes contracts with providers that have essentially said, look, let's find ways to reduce waste, improve outcomes, improve quality in the system, and we'll share in the savings. And there are more than 100,000 members that are in that arrangement today, which is substantial and bigger than anything else in the marketplace. And through that, we're finding ways to work with providers that didn't exist a little while ago. So taking opportunities and success stories like that and just carrying them forward into the future.
Yeah. You know, Representative Cody, as you know better than most, this isn't your first healthcare reform rodeo, and you've been around this conversation for a while, sometimes the same conversation over and over for a while. You know, we had a dinner with some folks last night, and I posed the question, somewhat tongue-in-cheek, but only a little bit, and perhaps cynically. There's a lot of innovation going on right now in the private sector. Folks are responding to the Affordable Care Act. They're responding to state-level reform. They're doing some pretty cool stuff. But did it take a law to get the healthcare sector to innovate? Does it take the bludgeon of an act of Congress, which is close to a miracle, or an act of the legislature? Does it take that kind of political leadership to force the healthcare sector to truly innovate?
I think so. I'd just say that probably through my 20 years of experience that even if just the threat of some legislation will usually get people's attention and be able to move things forward, it's I guess the only way we can get the attention of the marketplace sometimes is through legislation. So yes, I believe that we needed, I mean, if you look at all the cost drivers, like when the Clinton era, when they tried to do healthcare reform, that brought down the price of healthcare during that time. And then it went back up, and now we've seen it drop again with the Affordable Care Act. We've got it flattening out. I think it's those political pressures that what it takes to really get the attention of a marketplace that's huge. I mean, when it's almost 16% of our gross national product, we're a big part of the world, you know, the big part of what's happening in the economy. So, yeah, I think it does.
Why is that? I mean, you know, we have this sort of fundamental bias that at State of Reform, and the reason we host this in the way that we do, that the people who are very good in healthcare are usually specialists. They have a knowledge base and experience base that is a mile deep and an inch wide. Often people who are very good at politics are generalists, who have a knowledge base, experience base that's a mile wide and an inch deep. And both have this sort of fun little God complex thing that they kick around from time to time, except for the people up here and in this room. And it's sort of oil and water. And you have to kind of translate between the world of policy and the world of healthcare. Why is it that y'all don't talk more in constructive ways? Why is it that, it takes a bill, do you think?
That's a good question. Probably, I would say that money is always the basis of everything. And I think I found that after when I went down to the first time in the legislature, is a lot of other legislators, think of healthcare, that all the providers are really good people, and that, that money doesn't motivate anybody. And it doesn't take them very long in the healthcare committee before they start realizing that almost everything that comes in front of our committee, there's a dollar has something to do with it. And so I think that's the hard part, is how much money has really gotten into health. I can't say that when I went into nursing that I necessarily thought I was ever going to become rich. So I think that a lot of the providers do go in, not necessarily, as we start out thinking that you're going in to be a helper, and then all of a sudden after you get out of school, you go, well, wait a minute, I do want a decent paycheck, and I do, So you go through that, and I think that's the same. When you look at pharmaceuticals, the hospitals, the insurance industry, there's just a lot of different people that have to get their share of the dollar that goes into healthcare. And I think that's why it's not just two sides, there's about 5 sides in any discussion in healthcare. And so that's the other reason that I think it's very hard to make changes, is there's just so many different angles to it.
Yeah. Preston, hospitals sometimes get identified, there's a lot of money in hospitals, right? If you look at the total healthcare system, a lot of that money goes into hospitals. A lot of good care is provided there. Sort of 2 questions. One about rural healthcare. Providence has a history of supporting communities that might not otherwise make it based on mission. But also, how do you move the conversation from cost to value? And make it sort of real enough so that legislators and the public, in spite of perhaps a service that is very expensive, still believe there is value in the services that hospitals provide.
Sure, I'll take that. In terms of kind of representative question is, Providence has been around for 158 years. So we started the first hospital in Southwest Washington. Since that time, have grown to a system that covers 5 states, and we have a broad range of services from acute care health organizations to basically assisted living type facilities and everything in between. And our mission is to take care of the poor and vulnerable. So we really, anything that we generate as a bottom line goes back into those mission services. As a system last year, in 2012, we did $823 million in community benefit. Kind of going back down into Snohomish County, our organization did $54 million in community benefit, and I think that's #1 in the state for an acute adult hospital that's not tax supported. So, and we work off very relatively small margins, so we generate about a 2% operating margin. So it goes back in. And everything that we do, we really want to be as efficient as possible. So outside indicators of that, if you look at the Dartmouth Atlas and our market within Snohomish County, we rank number 30 out of 308 markets in the country. So we're in the top decile performance for kind of that value equation and those qualities. So the way we do that is getting back is how do we work with partners, whether they're payers or other types of providers, and really look at doing things in the right way. What's exciting about, I think, the Affordable Care Act is we know that healthcare is broken at 18% of the gross domestic product. And it's really forcing us to think outside the box and take care of differently and really create more access for everybody within the community. And we know that acute care is very expensive. So how do we get into other settings in terms of ambulatory care, home health settings, other types of way to treat patients when they're sick that are higher touch, but also in terms of innovative new work members of the workforce, care teams, home models of care, and different way of team concepts and care out in the community. So a lot of, as Jeff said, a lot of exciting models that can be done out there, and we're starting to work on those now.
Offer your feedback, and I recognize you're the only provider up here, and so therefore speak for all providers.
Yeah.
Not the case, but your thoughts on some of the certificate of need conversation and the changing regulations there, and maybe this notion of network adequacy regulations and strengthening those or changing those. And because I'm going to ask Lance or Jeff, one of the two, maybe both, how do you actually control healthcare costs if you have to let in every hospital? If you have to take everybody, how do you control healthcare costs?
Yeah, well, in terms of kind of the C of N question you asked about, in terms of just the regulatory environment, there is a big conflict about kind of current regulation on a lot of levels. So whether it's antitrust, whether it's C of N, whether it's the Stark anti-kickback, because the ACA, what it does is it says you need to work together in markets across organizations to create new models of care at a lower cost. Our existing regulatory environment says don't do this. You can't do this, you have to go through all these hurdles, you have to do this and add costs. So those are at conflict. So we need to think about different measurement or outcome statistics, whether it's cost of care in a community or other metrics that allow us to do these innovative type models. So that's kind of your first question. The second one, in terms of I think we need to reward providers and care systems that are more efficient. And it needs to have quality metrics, it needs to have access metrics, and it needs to have cost metrics.
Lance, I'll ask you this question. I'll preface. We have a couple rules of state reform that we try to adhere to. One of those is that you can't speak at our event 3 years in a row. You can speak 2 years in a row, but unless you're the governor or something, you only get 2 cracks at that, and we try to limit it. Joe Gifford is one person who's spoke all 4 years because we just like him. And when I think he's still here, he works for Providence now. Our first year, he worked for Regents. And that year he had a great presentation that was well received, where he cited the Attorney General of Massachusetts study that said 75% of price is determined by market leverage, and 25% of price is determined by cost. I haven't talked to him about that now that he's at Providence, but this question, how if market leverage drives cost, or rather price, but yet the Affordable Care Act is driving providers to integrate and consolidate and work more closely together. How, as a health plan, do you control some of those cost drivers when at the end of the day, some would say it's about leverage?
I think this is Wood. We're probably less affected by that because we're either the Medicaid or the Medicare, and we've been fortunate, I presume, because we are the safety net health plan, that the vast majority of providers are willing to provide services at either the Medicaid rates or Medicare rates, so we're not paying that premium, so they're not using that market leverage against us. From our perspective, the key to controlling the healthcare costs is not about trying to reduce the number of services or trying to lower the payments, because obviously we're getting a decent deal from that standpoint. It's about getting people the right quality of care and getting them healthy and keeping them from needing those services that require them to go to all the various specialties or through the ER or into the hospitals or whatever. And I think we demonstrated that. We've talked about that in some of these sessions with our Disability Lifeline program, where we integrated the behavioral health or the mental health in with the physical health. And we were able to show huge savings just by getting people routine care, coordinating that care, getting them on the appropriate meds, getting them seen when they need to be seen, so they didn't have these huge run off the track care requirements where they end up in the ER or in the hospital for mental, psychiatric care and that kind of thing. I think that's the key to most of it. We can talk all day about what drives the healthcare costs, but it's a very complicated thing. But from our perspective, it's not necessarily market leverage. That's not what we're experiencing.
I love how I give some of these speakers an opportunity to sort of get in trouble, and they all artfully dodge it, so well done. Jeff, I'll try again. You know, what about this question and of network adequacy? And I think Premera has been pretty proactive in engaging provider groups and trying to work in a collaborative way, and you're bending the cost curve as a result in those communities, I think. What about the notion that in some cases, especially pediatric, for instance, you really ought to have those folks in your network? And how do you control costs if you are required to keep large providers in your network?
Well, I'll continue.
The grand tradition of artfully dodging?
I will, maybe not so artfully dodge it, but I will not touch it. But I'll tell you this, there are many ways that we can approach cost containment in healthcare, and the network size and access is certainly one of those, and that has been used in the past. And there probably is some variation based on scale that provides some changes the dynamic in the negotiation. But it's just one tool of many, really. And in fact, it shouldn't be where the emphasis is placed in any case. It's around quality and safety. And if you do those two things, you'll get to the cost issue. So we put a lot of emphasis on, are we doing the right things, we, the healthcare system in total, and how can Premera support the industry, the providers, in delivering that sort of care. And there are lots of examples that I could share with you where we've helped improve quality and reduce cost in the process. Spinal cord stimulators, sleep studies, et cetera, et cetera. There are a number of examples that yield, advanced imaging is another place, that yield millions of dollars in savings that are really better for the patient and lead to a better outcome. The second area around cost containment is in transparency. So I appreciated the fact that there was a session on that today, because I'm a big believer in that. And I think to the extent that consumers and providers have the right information to make good choices, they will act in that manner. We certainly see it. We've got clients who, just by introducing health savings accounts, meaning they've brought some skin into the game for consumers, have seen their utilization drop tremendously. Now, are they foregoing care or not? Hard to tell, but we don't think so. We have seen studies in our own population that show a difference of nearly 40% in utilization between those that are on extremely rich benefits and those who are on higher deductibles. And here's the key, there's no difference in health outcome. None. The health status is the same. So it's just people being more thoughtful as they consume health care. So transparency is another way. And then last is through collaboration with providers, doing things around care management to ensure that the patient experience and outcome is optimized. None of that involves shrinking of the network, though that's one approach that has been taken and I think will be considered going forward.
DJ, can I?
Please.
Let me jump in on this one, because I may say something that's get myself
Please.
in trouble.
Good,
I
love that.
actually think that the network adequacy question, I am sympathetic to the insurers on this one. I don't think that it is necessarily a problem to have a tighter network as long as the consumer knows that's what they're buying. I think that's really the key is, you know, if you're willing to, I worked in an HMO for 35 years, you know, it's like people need to know what they're getting into. And so I think that it's fine to be able to have a tighter network, to be able to contain costs. It's just to make sure that people are aware of what they're purchasing when they get it. And I think that's where the difficulty comes in, because people are not used to that tighter network. So that might surprise the insurers.
No, I appreciate
here.
you saying that.
And, you know, I'll jump in there. We are rapidly moving into consumerism. The cost curve's already bent. A lot of the major corporations are giving, you know, just a bucket of money, go out and buy your products, you know, a lot of pocket out of cost. So people are very tuned to value in terms of both that quality and cost continuum the transparency piece, Providence is rolling out a product called Castlight, so that, and we're piloting with all our employees, and it basically says if you go down to Joe's MRI, stand down the street, or if you went to Providence, what would be the price and the quality of that? So we're being transparent with our own staff, and that will drive down the cost of care and improve quality and service and access. And that's what's happening out there, and we'll come out of the other end better for this, or the consumer will.
So Representative Cody, as you know, there was a kerfuffle in August when the Insurance Commissioner's Office approved some plans like Premera to be sent to the exchange for consideration, did not approve some plans like CHPW to be sent to the exchange for consideration. It's my understanding that Providence Health Plans may be looking at entering the market in 2015, may or may not be. It sure seemed kind of like a regulatory mess. I mean, whose job is it to make sure that we get exchange plans that want to be on approved and onto the exchange so that consumers can have choice and can have transparency? It's not, maybe it's not the governor's job, maybe it's not the OIC's job, maybe it's not the exchange's job, maybe it's not the legislature's job. What would you say? What are the lessons learned from that we might be looking for in the coming session?
Well, I think that, it is the insurance commissioner that makes those decisions, but we certainly had a lot of discussions in the time frame to encourage to be able to get all the plans in, because we want to see as many plans on the exchange as we possibly can get, so that there is that competition and people have a choice. I think with it, fortunately, things got worked out and we got more plans onto the exchange than what were originally going to be approved. Interestingly enough, that there's some lawsuits about that, but we'll see how on the network adequacy question. I think that what we learned is that we didn't have good enough definitions of what network adequacy really is and what that means. And I know that the insurance commissioner is working on that now. From the legislative perspective, we haven't, I haven't jumped in and said, oh, we have to have a bill about this at this point, but there may be some reason. I did ask, does this mean that we're over-regulating if these plans that have been able to get in other states couldn't get in here? What was the question? And so I think we were able to at least work through that and be able to get people onto the exchange. So
I'm sure that these gentlemen would not answer this question at all. So I'll pose it to you, Representative, and see what you think. There is some conversation, particularly from I think Senate Republicans or the Majority Coalition Caucus, that would suggest that in order to streamline the administration of this process and to put the responsibilities squarely on the shoulder of Governor Inslee, that the Insurance Commissioner's Office, which is statutorily created, not constitutionally created, should be eliminated and rolled into, or rather, there should not be a commissioner. Rather, that office and those responsibilities should be rolled into under the governor's direct responsibility, so that position is no longer
appointed rather than elected.
Exactly. What do you think about that? And I guess, what do you think about it?
Well, actually, I think that it's something that we should look at, believe it or not, because at this point, we have the problem of the Insurance Commissioner's Office and an exchange board that are doing similar, or not similar, but they need to be working together. And unfortunately, right now, the governor is not over either one of those bodies. And so there's nobody that is the last, where does the buck stop?
Yeah.
And the legislature tries. We have control over both budgets, but that's about it. And that's kind of a big stick to have to use. So I think that from both sides, on the exchange and the Insurance Commissioner's Office, we need to look at the structures and determine what's the best way to move forward on it. I think, we set up the exchange as a public-private partnership. I'm not sure that that's the right way to continue. I think we needed it that way to start with, but maybe they should be coming back in as a state agency.
Yeah. So we'll go through a quick round of last questions for you all. And we'll start with you, Preston.
Sure.
What would your advice be to us all in the room here today about moving forward through this time of chaos?
I would just say work together. I think no one in the room in any organization has enough money to do what we need to do, but by working together and being smart about how we're doing care across the entire continuum, I think there is a huge advantage. And we have a lot of models around there that are being successful that way.
Great. Lance, what would your advice be to everyone who's here today and to legislators and to folks who then watch this on our website?
Well, I'm going to agree with Preston. I think it's easy for all of us to complain about all the things that don't work exactly the way we want them to, but I think we need to look at it in a bigger context of, okay, ACA was difficult, but it got passed. Implementation's been difficult, but it's gotten done. Governor Inslee was here today, and I'm listening to him and thinking about, a lot of great things have happened, and has it been absolutely perfect? No. I speak with people all across the country, and they all are lamenting the issues they have with either the federal exchanges or their own states, and they're all going, but you guys in Washington really haven't figured out. And I'm sitting here thinking, no, I know all the problem, but the problem is we all know what the warts are, but you got to think about it in a bigger context of we got a lot of things going in the right direction. I think for all intents and purposes, all of us are trying to achieve the same thing. To the degree that we figure out how to work together and achieve that, we're much better and further ahead in the state than everybody else is, and we ought to be happy about that.
Glass is 80% full, not 20% empty, right?
It's 100% full. It's just 20% of it's air.
Jeff, what would your advice be to this community?
Well, I agree with Preston and Lance on this completely. I think working together is going to be a really important thing. I'd add one other thing to that is, give it time. I mean, we have just gone through some momentous change, and in fact, the rules have been changing up until just a few weeks ago. And there was enough uncertainty even before the rules were still moving that I think it's time to kind of let the dust settle a little bit and see how everything has played out before we start to tinker with the changes that were just made. There's lots of energy, and we ought to capitalize on that energy, but it ought to be in a stable environment so that we can see, in fact, how those changes have the effect that they've had, and to give us a chance to kind of work within that construct.
Great. Representative Cody, last word. What would your advice be, particularly to the private sector here today, about navigating reform generally, but also about how they might work with the legislature moving forward?
Well, I think that, as Governor Inslee laid out what he was interested in, and I think that the transparency issue is going to be a big one that we're going to continue to work forward. But I agree, trying to let the dust settle on the things that we have done is a good plan. I think we need to work and just, if we see problems, try and figure out how to do it, and hopefully not have a lot of legislation regarding the healthcare reform change. So in other words, I'm not introducing a 12-foot change bill. But
you have that innovation plan bill. That's kind of a big deal.
Well, I don't think it's that big a deal. It's what we've talked about. I mean, I think what we're doing is just moving forward and implementing the things that have been in discussion for years. I don't know whether you've seen today, Levitt and former Governor Levitt out of Utah and the governor, and I can't remember his name, that used to be in Colorado. Well, they had been sharing a commission on lowering costs, and their report came out. And they give, for all the states, the state laboratories are where we should see the changes in how we can start controlling costs. That's what it's 116 pages, I think, of their report. And some of the things that they talk about are all the things we've been talking about here in Washington State, and some of the things that we've already been moving forward on. But I think that they're very good ideas, bipartisan ideas that we can work on, and it's really trying to get us all doing the same outcome measures, looking at the same measures, getting definitions that we all agree upon, and that means public and private sector. So I think that that's the kind of work that we'll be really trying to move forward on.
Great. Representative Cody, Chair of the House Health and Wellness Committee, thank you. Preston Simmons, CEO of the Providence Medical Center, Everett, thank you. Lance Hunsinger, CEO of CHPW, and Jeff Rowe, President of Premera, thank you all very much for being here. Let's give them a round of applause.
Thank you.
Thank you all for joining us. That concludes our day. I really appreciate you being here and participating, and I hope to see you again here next year. Thanks a lot.